Advice and guidance is a way of asking clinicians in hospital for advice. It's a bit like an email within a system that integrates within our clinical systems. There are advantages for the patient, for the GP, and indeed the system and secondary care. The first thing to consider is the speed of response. So they get a fast opinion, you get a specialist opinion that you otherwise wouldn't have done.
They booked me in for a routine appointment, which I went down to the doctors to see them, used some device on me, took some pictures and sent it off to a consultant at a hospital. No more than a week went by and he phoned me up and said that the specialist had looked at it and there was no cause for concern. I think it was brilliant. The NHS have been fantastic, the doctor was superb. They seem to have cut out a whole step in the process. It got done within 5 days. It took a 90-second phone call and saved wasting everybody's time. So I think it's nothing but a benefit.
Accurx is a communication system. It's mainly by messaging. It's between the primary care and the patients. So it is quite useful as a communication tool. It is also a very useful tool to get pictures back from patients which they have concerns about skin things.
I needed to contact the GP because I've got a very small lump under my skin in my arm, on my upper arm. And I reached out because I didn't know what it was, and I had a text message following that via the AccuRx system, which was asking me to send photos in, which I did and submitted those via the link that they sent me. It was very convenient to use. It saved me going to the surgery initially, and to have the text messages come back via the AccuRx system was very helpful because I knew what was happening and I knew that something was being dealt with.
There's no doubt about it that a digital medical record is probably one of the most important things we can do to improve quality and safety and also patient experience. One of the things that patients tell us most frequently is how frustrated they are with having to tell their story again and again and again. But if you've got a digital record, of course, that's accessible from anywhere, and so all that information is immediately available to the clinician that's seeing you.
And I was recently in hospital, and a lot of tests, a lot of things recorded on the computer, and it was noticeable to me compared to previous admissions that when the doctor or nurse or whoever it was came to see me, they knew what had been put onto this machine without having to repeat the question. I have a number of conditions, different specialists, but I've got one set of patient notes, and if I happen to be trying to deal with two people, only one of them can see those notes. On the electronic system, they can both see it, and they can both see it at the same time.
Digital therapy has actually come really naturally to a lot of people, even people that didn't think that they would be able to participate. And it's really prompted us to think about how much we do incorporate technology.
It was actually really nice to have something that was kind of stable throughout the lockdown. But I think it just takes out that whole anxiety of just having to go out in the public. And yeah, I think that is what really, for me personally, I preferred that over actual people coming in and yeah, be sitting in a room. It's not my cup of tea.
I think that therapy can be delivered digitally and really well.
We've had people in their 80s and 90s using technology for the first time, which has been incredible. People with learning difficulties who would never have felt that they could use this equipment now confidently Googling things. So we've been loaning equipment to people who are job seeking, and then also people in that sort of younger age category who've never had tech, either because they couldn't afford it or because they've never had the training and they don't really know what to do with it.
It keeps me connected to my family. Also, I can get the local news up on there, Dursley Matters and Dursley Natters, that's quite good as well. So yeah, it just keeps you connected really to the outside world.
My grandson is in Canada, family. They arrange a time for me to pick this up, and then they talk to me for a little while. It's nice to be able to talk to them.